Welcome everyone to our webinar on health impact assessment, a vital tool for ensuring health equity. It is a webinar that is taking place as part of the EUPHA European Public Health Week. It's the final day of that week, and health impact assessment is an important topic. EuroHealthNet is organizing this webinar. And for those of you who do not know me, my name is Caroline Kostongs, and I'm the director of EuroHealthNet, which is a European partnership for health equity and well-being. Health impact assessment is very important to us. It's an important tool to facilitate working across sectors, and also to, if we wish to achieve a well-being economy or well-being societies, we need more and more to use health impact assessments in order to convince policymakers what the right direction is to go for with their policy measures. So what we have been doing, we have been looking around the partnership for best practices and for methods and resources that our member agencies are using, which are mostly national public health institutes, and we brought this together in a guide which is specifically created for our members. But we wanted to also have this webinar to exchange thoughts and to learn from each other. And I will soon present Sofia Romagosa. She is our project officer and has done a lot of this work, and she will be able to present the findings of that work that we did. But before I ask Sofia to share her presentation with us, I would like to ask you to, for now, close down your video, and you will have the opportunity at the end of the webinar to present yourself, to give your comments and your observations to what has been said. But for now, I would like to give the space for the speakers to be there and to be visible to you all. So please, of course, you can use the chat if you already have comments or questions during the webinar, but we'll have this opportunity later on, about 20 minutes with the discussion with the audience. So if I can then ask everyone indeed to switch off your videos, and then I will give the floor to Sofia for her presentation.
Thank you, Caroline. Good morning, everyone. It's exciting to present all of you this webinar. I'm going to give you now a brief introduction on why health impact assessment is important for ensuring health equity, but I think it's important to start with actually an understanding of what a health impact assessment actually is. For those who do not know, it's a process that judges in a systematic way the health implications of a proposal, of a new project, of a new program, a new plan, a new policy, a new strategy, and understand what are the potential, sometimes unintended effects of this proposal on the health of the population and on different groups within this population. So you might wonder, why is health impact assessment relevant for health equity? Well, it's important to understand that health impact assessment recognizes the... Sorry, can you hear me? Yes. So it's important to understand that health impact assessment recognizes how health is influenced by the social determinants of health, in general, and how the health status in a population is the result of a complex interaction between social, economic, and environmental conditions, and is actually this unequal exposure of the individuals in a population that actually contributes to the development of health inequities and contributes to this uneven distribution of the health status of the individuals in a populations. So health impact assessment to help us to assess how these potential impacts, both positive and negative, of a proposal might affect the health determinants and might differ across different population groups in a community. And what is really valuable of health impact assessment is actually how the local communities that might be potentially affected by a proposal are actually involved throughout the process from very early stages. And by involving the local communities that might be affected by this proposal, we are able to understand the needs of a community, the priorities of a community, or the concerns of a community that will definitely help to increase the acceptance of this proposal and future implementation of the proposal in the community if authorities decide to move forward with the proposal. So as a result of the health impact assessment process, recommendations are provided to decision makers and to policy makers to reduce the potential negative effects of a proposal and how to increase the health benefits of the proposal, the potential effects of this proposal to support the implementation of programs, of projects, or of plans and policies that strive to adopt a health in all policies approach and achieve health equity in society. So equity as a principle is actually recognized as a governing value in HIA. However, in practice, it's not always adequately addressed. And as Caroline mentioned at the beginning, EuroHealthNet has worked in the past months with members to develop an internal guide for members on how to ensure that the equity principle is ensured throughout the whole HIA process. And resulting from this work, we developed the following recommendations. Starting with, it's important that the competent authorities are encouraged to invest in data collection and data monitoring in order to have access to up-to-date health and social data. Particularly, what it's important is to be able to have the ability to disaggregate this data by social stratifiers, looking at the data by educational levels, by income, by ethnicity, so that throughout the health impact assessment, we're able to identify potential health equity impacts, and we are able to inform decision makers and policy makers on equity issues that are related to the proposal under assessment. Another recommendation that we came up with is the importance to develop mapping exercise in order to identify the right people and the right populations when we were talking about involving in the HIA process and involving the local communities. It's important to identify the right people in the process, and in special consideration those groups in the community that can be more vulnerable and that can be more potentially affected by the proposal. Third, what is also important is to, at the beginning of the process of a health impact assessment, develop community profiles. This is also an exercise that gathers information, contextual information of the community, including sociodemographics, including information on the health status of the population, or to understand the economic, environmental, or social conditions in which the individuals in a community live in. Because with this information, we're able to understand the social gradient of the community, and we are able to understand the needs of a community. We're able to identify those groups in a community that can be mostly affected by the proposal or that can benefit the most from the proposal under assessment. So yes, this contextual information will definitely be relevant when developing the final recommendations for decision makers on the proposal. And last, as a result of a health impact assessment, sometimes it can be that we have like a very long list of recommendations. So it's very important that there is a prioritization exercise of recommendations to identify those that help to mitigate the potential negative impact of the proposal and that promote equitable health and well-being outcomes once the proposal is implemented. So yeah, as part of this exercise and work that we did with our members in the last months, we also identified best practices, as Caroline mentioned. Due to a limited time, I'm not able to provide or present in detail all these examples, but something that we wanted to stress is that actually setting up formal structures and providing guidance to the professionals conducting a health impact assessment can definitely contribute to conducting health impact assessments in the right way and implementing successfully the final recommendations. And that can definitely, and also that can contribute as well to ensuring that the equity principle is included and taken into consideration in the whole process. Just to provide a few examples, in Wales or Scotland, they supported health impact assessment supporting units that provide guidance on how to do health impact assessments and do these assessments according to local and national regulations, but also having established supporting networks for professionals can be very helpful as an available platform for professionals to exchange expertise and experiences, and same with providing training for the professionals or having available case studies on how to do actual health impact assessment in practice definitely will all contribute in making sure that health equity is ensured throughout the whole health impact assessments. So until here, this is my presentation. I hope this gave you a clear understanding on why health impact assessments are important to ensure health equity. And I would like to give you back the word now, Caroline.
Thanks, Sophia, for excellently setting out health impact assessment, and it sets very nicely the scene for our expert panel discussion. And I'm giving the floor now to Alba Godfrey. She's our senior coordinator, and she will moderate the session with our experts. Alba, the floor is yours.
Thanks, Caroline. Yeah, so I'm very happy now to be moving to the panel discussion section of our webinar this morning. I'll start by introducing our 4 panelists. And so if I could ask that just the 4 panelists have their videos on, and then everybody is welcome at the end to turn their videos on afterwards for the Q&A with the audience. So with us this morning, and I think many of you already know who is there, but still worthwhile introducing our great speakers. So we have Piedad Martín-Olmedo, who's a health protection senior scientist at the Andalusian School of Public Health and also president of the HIA section at EUPHA. Liz Green, who's a consultant in public health policy and international health at Public Health Wales. Ben Cave, who's a director of BCA Insight Limited and also an honorary professor at the University of Liverpool and member of the EUPHA HIA steering committee. And Helen Hassel, who's a health improvement manager at part of the Health Impact Assessment Support Unit at Public Health Scotland. So how this is going to work, we have about 25 minutes and I'm going to ask our speakers a couple of guiding questions that will be the same for all 4 panelists. So the idea is that they're building on what the previous speaker has been saying. And apologies in advance if I am quite strict with time, as we do have limited time this morning. So my first question to all of you, building as well on what Sophia was saying in her presentation and the work that we've been doing over the past months, how can we ensure, first of all, that HIA are carried out and that when they are conducted, that they include this strong equity focus? So what are, from your perspective, some lessons learned, also from implementation on the ground in the different countries? What are really the key elements to have this strong equity focus in health impact assessments? So I'll start by handing the floor to Piedad.
Good morning, everybody. Thank you very much to EuroHealthNet for organizing this seminar and for inviting me, representing the EUPHA and also the Andalusian School of Public Health. Well, it's true. I mean, Sophia did a very nice presentation, and health equity is already a pillar, a fundamental pillar of HIA, and as such, it was included in the definition of HIA proposed by WHO back in 1999. But it's true that the fear that HIA represents at administrative overloaded that hinders the economical development is still prevailing in many European regions and countries, that is making difficult for HIA to be conducted properly, and of course to address health inequalities. So for me, a very important still pending question is to make more political stewardship, incorporating the health and equity as a pillar of a sustainable economy. So HIA health policy is a strategy that is running for long now, but in my appreciation, is something that is still not being incorporated at the political level in a cross-cutting way. No, it's like maybe we should have, even from the European Commission, something that make more emphasis that need to be incorporated at the top level on the governmental level. And another aspect, of course, on that is to maybe from public health officers and public health agencies to be more advocacy on the understanding of the benefits for cross collaboration. Of course, maybe we need to be revising our proposals and incorporated this new approach of health for all policies. It's like making other sectors to understand that we don't want to impose health considerations over other consideration from other sectors, but to bring a win-win approach. I don't know if you want me to go into the environmental aspect, or I just pass through my colleague Ben Cave on that.
Okay, maybe that's good for a start, and then we can come back to you as well to maybe talk a little bit about environmental assessments.
So I hand it to Ben.
Thanks, Piedad. A really strong call there then for more incorporation at political level and the need for political will, and also this emphasis on cross-sector collaboration. So really great points to start with. Liz, I hand over to you.
Thank you. Yes. Well, one of my key points was exactly what Piedad's just said about political will and stewardship. And Wales is very lucky in that respect, because we have a very friendly context, politically and socially, towards health impact assessment. And so equity and inequalities is a key pillar of their or addressing these issues is a key pillar of Welsh Government policy. And therefore, when we have this Public Health Act, again, we're very lucky, that has made HIA statutory in the country from next year. It very clearly sets out on the face of that act, well, actually, you've got to consider inequalities and equity and health and well-being and the broader determinants of health. So legislation is one very clear driver, not only to help them be carried out, but also to make sure equity is included. And then at a more sort of specific level, just things like training, awareness raising, and things like guidance and tools and checklists that list population groups. And so it's almost like a carrot and a stick. You can provide lots of good things for people to follow, but actually sometimes you have to make them do it. But Wales has also been very fortunate in that having this unit to help people has ensured that they are voluntarily carried out and that they do consider equity and inequalities in population groups. I will leave the environmental assessment one as well, and I'll hand that back to Ben.
Thanks, Liz. So some nice points about legislation, but also about the need for training, for guidance, for tools, for support. So I think those are all really important. Ben, a lot of anticipation coming to you to talk about environmental assessments. So maybe you can tell us a bit more about those.
Thank you, and thank you for inviting me, and it's lovely to see everybody here. I think the main opportunity afforded by environmental assessment is that it's required across all member states. There's the Strategic Environmental Assessment Directive that looks at plans and programs that set the framework for planning consent. And there's the Environmental Impact Assessment Directive, which looks at projects. These both formally require human health to be considered. They are currently typically carried out without input from public health teams. And there are some notable exceptions to that, and Piedad can speak to that as well. In Andalusia, I think there's a guidance there. We, with EUPHA and International Association for Impact Assessment, have provided guidance on that. So I think that's the environmental assessment question. I think how do we ensure that there's a strong equity focus is involve people, full stop. Make sure you involve people and involve them properly. And then finally, just to close down, how do we ensure that HIAs are conducted and conducted well? I would say public health teams need to step forward. We need to get everybody else involved, but we also need public health teams to show leadership. And I can tell you as a consultant working in public health, it's a lot easier when a public health team engages properly with the impact assessment that I am writing. You get a much, much better impact assessment coming out of it. So public health teams step forward.
Thanks, Ben. A lot there to unpack. I hope we have time to come back at the end of the panel because I have some more questions there to follow up. But maybe I'll give the floor to Helen first and then come back for some further questions.
Thanks, Alba, and good morning, everyone. And thank you for inviting me along this morning. So obviously we've kind of talked about quite a lot of different elements in relation to health impact assessment already. So I'll just maybe kind of talk a little bit about some of the work we're doing in Scotland as well, and then come on to a few key points. We've got our Scottish Health Inequalities Impact Assessment Network, or HIA as we refer to it, which was referenced by Sophia in the presentation. And we've had that for many years now, and there's a good number of practitioners with an interest in HIA. And that group's been really valuable in supporting the development of guidance that we've got within Scotland, and sort of various other resources and case studies on HIA. And having that kind of group is really helpful to kind of get that co-production and that buy-in into the guidance, and having that forum to be able to share learning experiences and have that peer support. Our health impact assessment support unit was set up a couple of years ago. We have actually had quite almost a complete turnover of staff in that time, and we are a small unit. But we're kind of working now on refreshing our guidance and resources, and having that, as sort of Liz alluded to, as kind of key things that we want to be able to have to support people to undertake health impact assessment. As part of that, we're also looking to develop case studies, and one of our main focuses is around building that capacity. And I suppose kind of following on from kind of what's been said, it would be fantastic to have that political mandate to be able to undertake HIA. We're not there yet in Scotland, but it's something that we're really keen for. But again, that doesn't necessarily sort of make it a straightforward process of something that is done and done well. It's all about making it meaningful. And if we're going to undertake an HIA, we want to have that value, and for it not just be a tokenistic process. So in terms of laying that groundwork and making sure that equity is understood as a key element and making sure it's important, I think it's about having that broader understanding of what health impact assessment is beyond our sort of health sphere, as it were, and the value of the process that brings. And linked to that, it's about having people having that understanding of social determinants of health, and having that wider awareness of health and all policies approach, and building those partnerships between health and other sectors. And then, as kind of Ben suggested, it's building that capacity within public health to be able to have that arena, I suppose, to link out beyond their forum and provide that support to other sectors to undertake HIA. We know that we do have challenges within Scotland because our public health capacity is small. We have small teams, and so it's not necessarily straightforward as just asking them to help. But kind of capacity building is one of our key elements to our plan, and also I suppose kind of building that knowledge of people that are involved in other impact assessment processes but maybe don't have that background in health, so ensuring that they have that equity building.
Thanks, Helen. So really that capacity building is answering Ben's call for public health teams to step up. And also what you were mentioning about the social determinants, the health in all policies, cross-collaboration is also feeding nicely into what Piedad was kicking us off with the start about this importance of intersectoral, cross-sectoral work. Maybe I will hand back to you, Piedad, just because Ben also passed you the ball on the environmental impact assessments and an example of what you're doing in Andalusia on the ground.
Okay, thank you. Yes, I didn't mention because I wanted to go first to the overall issue, you know. But yes, I mean, it's true that first in Andalusia, there was this political involvement. Really, the director of public health make a very strong effort and develop a proposal legislation. So develop the public health law, and there a very specific procedure. That's something that also very important, that developers and also public health officers, they need to have very clear procedures. And in our case, the HIA has a very narrow scope, or not very narrow, but narrow directly to the environmental impact assessment that are included in the EA legislation. And for that, there is very, you know, they created two guidance documents and very much procedures. And also they created a specific and organized public health teams. So they are dedicated officers that need to revise the HIA proposals that are done by the proponents. And on that, it was also done creating a very strong collaboration first on procedures together between environmental staff and public health officers. So that was very important to create this very clear dialogue between the two sectors, and then to create the whole structure in the public health. And also we created specific training and a platform that act as a coaching platform for the practitioners who are running an evaluation of an HIA. They can learn from others. So that this is something also important. Maybe something that we can and we should be improving is that the participatory process is just the broad one, you know, just to announce the project in a platform and just to try to gather input from the public. And I think this can have a space for improvement, because engaging is something more.
Yeah, participatory processes are always very difficult, and engaging with the right people and engaging with different groups of people as well. But thanks for providing that nice concrete example as well of what you're doing in Andalusia. So I'd now like to move to my second question for all speakers. And this focuses more on, so once we've done an HIA, hopefully with a strong equity focus, what needs to happen to facilitate the implementation of all these recommendations that are coming out of it? And again, having this focus on promoting health equity in also the implementation of the recommendations. And I'd like to switch around the order a bit now, so I'll turn to Ben first.
Thank you very much. This question is close to my heart. I am conducting PhD research on this at the moment. Just some points. I would take issue, or I would draw your attention to the word recommendation there. Health impact assessment has started out as a consensual process, reaching agreement, and this is because it's been outside of the legislative process. In other forms of assessment, they look towards agreeing conditions or controls or measures which have formal weight. So I think we should be aware of that as a difference there. That we need that consensual approach, but we also need things to be enforced. I would also draw attention to the opening slide, which some of the opening slides, which had a definition of health impact assessment, one of which was from the International Association for Impact Assessment, and it described it as a process. It also left off the final sentence of the definition, which says HIA guides the establishment of a framework for monitoring and evaluating changes in health. Health impact assessment is about making changes. It's not just about conducting the analysis. So this is a critical question, and I will hand over at this point. I'll be very interested to hear what the others have to say about it.
So you've set the floor and then handing over to everybody else. Very nicely done. Helen, if you can take up that challenge then from Ben.
Thanks, Alba. And yeah, I suppose as Ben has said, the value of HIA is the change that results of it. Obviously, the process is vital to that. But if we don't have anything that's meaningful has come out of the result, then we've kind of not really made the best use of our time there. So from one of the things we sort of recommend within our guidance within Scotland is around, once you have those recommendations, is ideally you'd like to create a clear action plan in terms of what's going to happen next as a result of those. So in terms of specific actions resulting from those recommendations, who's going to implement them, what the timescales are, resources, and the monitoring process, so that you've really got then a clear framework for what's happening next, and that sort of accountability element in terms of change, as it were. And that monitoring step is really key to obviously make sure that happens, and defining what is going to be monitored in terms of the sort of different data and what we're kind of looking at in terms of changes for populations or in relation to the determinants is essential. And it might be that there's a group that has oversight for that, and ideally if it's part of an established or routine process, then you have that kind of framework there where it's being looked at in a sort of regular environment, as it were. But we've kind of discussed recently at our network meeting that one of the challenges is capturing the impact of health impact assessment, and it's not always an easy process. The HIA report is that final step, and then you're obviously kind of looking for things to happen further down the line. So whether we kind of need to build in some sort of follow-up time periods to have follow-up report looking at that change. Obviously, we're kind of getting into the realms of evaluation there, so it is a bit of a balance. And I suppose just recognising the challenges around within HIA, you're often recommending changes to a plan which haven't yet been implemented. So it's not necessarily quite straightforward in terms of demonstrating the impact, because you're advocating for to make amendments to things that haven't actually been put in place. So it's not a tricky thing, but obviously the recommendations are key, and having that sort of monitoring framework and accountability. And then just finally, I suppose the other thing which I'm sure Liz will cover as well is just the value of making sure we've kind of got the quality process in the starting point. So Wales have got their quality assurance review framework, which is something we're looking at potentially developing as well. And if you're not having that good quality process in the first place, then you're not going to have good quality recommendations.
Thanks a lot, Helen. That was really great. So accountability, monitoring, clear responsibilities, assignation, that's really important. And you also handed over the floor to Liz, talking already about what they're doing in Wales. So if you want to pick up on that, Liz.
Thank you. Yes. Well, all three have picked up on points that I was going to raise, particularly around monitoring and evaluation as a community, particularly with standalone HIAs. We tend to, or they're carried out and then people move on to the next thing and they don't review. So as a unit, the Wales HIA Support Unit are trying to go back and review things. We carried out and published a Brexit health impact assessment in 2019, and we're going back and reviewing that, not just about our prediction, but actually any of the changes or where the recommendations taken up. So you can do that, but it is time and resource intensive. That again, people, so there's something there about making that process easier, and the QA process, the quality assurance, can help doing that. I think in terms of actually what we need to make sure they're implemented as well, it's that ownership. whoever commissions the HIA has to accept that actually whatever comes out of it, if it's an independent HIA, they are going to take forward those recommendations. And I think as practitioners, it's also important that we recognise that whilst these recommendations, be it strategic or a local level, might be ambitious, they also need to be practical and realistic and implementable, because otherwise you won't get that kind of buy-in. And one other thing about the recommendations, just to touch on, again, going back to the legislation in Wales, the Public Health Act and the regulations around statutory HIA will mean that the public body who carries them out, or who has them carried out for them, have to not only publish the HIA, but also say how they have implemented any recommendations. So for me, it flows on from something Ben was saying about it's important to act and not just do.
Yeah, and so maybe also a need for this transparency and then the ownership and the buy-in, as you were saying. Yeah, thank you.
Because you can hold people to account then.
Yeah.
Why didn't you do that? Or why did you do it?
Piedad, I hand over to you for the final word.
Well, it's difficult because I think my colleagues that cover almost everything. Of course, I agree with them. Maybe I just emphasize also on the scoping. And the scoping, we should. The developers and those involved in the HIA, those who say, we recommend to do the HIA, they should be committed to adapt. There should be a kind of contract that said, yes, I'm going to incorporate the recommendation. Otherwise, there is no point to go ahead and do an HIA, In the case of Andalusia, of course, because there is the legislation and a procedure, it's clear that they have to incorporate it. And there is also a procedure for monitoring what those health changes has been proposed, And in fact, if although the HIA is incorporated, is integrated in the environmental impact assessment, if they don't get the green light from public health, they will not go ahead. Okay, so that's what I can contribute it there.
Thanks. So we've reached the end of this panel discussion, but we still have more time for all of you during the Q&A. So thank you so much to all of you. That was really insightful. And thanks as well for keeping to the strict time. I hand back to Caroline.
Yeah, thanks a lot all. It was really an amazing discussion, and also some nice comments in the chat. One from Timo Staal about the need for public health teams to integrate in impact assessment processes in other sectors. And Mohammed Irfan still wondering whether HIA is not sort of a tick box exercise, but I think the discussion made very clear that we need to also focus on the take up of the recommendations, and you set out exactly how that can be done, and the need for an active role of public health leadership indeed. And there was also a question from Grace about the feasibility in some countries and low middle income countries of evaluation of some of the interventions. But I suggest we take these questions at the very end. Before we start with the discussion, I would like to give the health minister actually of the Basque government, Godzone Sagardui, the possibility to give some of her reflections. And I also believe that Godzone has a PowerPoint. You have 5 minutes. The floor is yours.
Thank you very much. I have to say that it has been very nice for me to have the chance of listening to all of you, and I'll try to share with you which is the perspective of the Basque country and where are we. First of all, if we go to the first image, which is...
We go to the first slide, David, yes.
A little bit further. A little bit further. No, it's not. That's not the first one, I'm afraid. It should be maybe the third one or something like that. The very beginning one is it's one for a context, location, a little bit of location and context of the Department of Health of the Basque Country. As you know, we are a regional country, and in Spain, the health system is a really very decentralized system. No, there are 17 self-governing autonomous communities and 2 autonomous cities. The map of competences is regulated in the Spanish Constitution, and while some are exclusively managed by the central government, most of them are shared between the central and regional governments. As regards health, the division of competences across various levels of government is quite complex. That makes that the Basque government is the health authority of the Basque Country, responsible of providing the stewardship, planning, organization, administration, and evaluation of the relevant health plan and programs, as well as providing oversight and direction to the provision of health services, including services in the public health domain. That's it. Very well. Thank you. And also about the healthcare. So services in public health domain and healthcare are in charge of the Basque government. Within that normative framework, methodology for health impact assessment of program and policies was designed some years ago. We are talking about maybe year 2000 more or less. No? Recently, it is one of the best things I think we have done in the last 4 years. We have published a new public health law that especially related to HIA in the Basque Country and the social determinants of health. That was one of the points when we were working on the law. Why? Because during the pandemic, we realized that we were lacking also of legislative power to try to improve our way of sharing and making it more transversal, as has already been told, all the determinants related with health. If we go to the next image, we will see that at a regional level, the recently published Public Health Act of the Basque Country includes under its priorities, as I already said, to analyze the impact of health and of the physical environment of the different sectoral policies, especially the correlation between human health, environment, and animal health, as recognized by the name of the One Health. Going a little bit further, next image, we see that the interest of the Basque Country institution has been increasing during the last years. In year 2023, we received 135 requests related primarily to authorization of projects of major infrastructure development. That means that other institutions are very worried about what impact it could have among the health of the citizens, urban planning and urban regeneration, and implementation of industries with potential of environmental impact. We think that's a good practice because it means that they are being conscious that what they do in any other kind of initiatives could have an impact on our citizens' health. Next image, please. We can see that here in the year 2014, the Health Department of the Basque government developed a screening tool for HIA designed to identify the policies, programs, social and environmental interventions that would be likely to impact on the social determinants of health. If any potential impact is defined, a full health impact assessment is recommended. This tool, kind of checklist, was based on the model of the Commission of Social Determinants of Health and was validated in the Basque Country through its application to 14 regional public policies together with a qualitative study. I mean, it's not only an exercise of trying to determine a checklist, but also to have proved it from the practice, something that was called to be previously. Through the screening tool, a rapid assessment is made of the possible links between specific projects or policies and the social determinants of health. In this way, it is possible to discriminate the policy proposals, policy, program, or project, whichever of them, more likely to produce a relevant effect on health, positive or negative. The pool is organized in 3 sections. And section 1 that considers the strategic relevance of the policy proposals of the Basque government. Section 2 assesses the likelihood of any impact of the proposal on the social determinants of health and health inequalities. And section 3 summarizes the information gathered in the previous sections and introduces even questions to try to evaluate the pertinence, the feasibility, or the opportunity or to advance with the project. This screening tool was also studied by different autonomous communities of the Basque Country, and even the Spanish Ministry of Health adopted it to develop the companion guide. Companion guide that was summarized for all the different communities of the state of Spain, and that nowadays is being one of the guidance tools, as we tell. If we go to the next image, we just wanted to mention a couple of real examples of the implementation of our experience. There was one in the city of Bilbao, comprehensive to urban reform of a neighborhood in the city of Bilbao in the year 2004. There was another one in Pasay Bay in the year 2010, and also training in the year 2012 of a wide representation of public health staff from the DOH of the Basque Country attended a comprehensive HIA course program given by Impact together with the University of Liverpool. As you see, we have done different research and also different contrasts with also different politics or maybe estimates where to implement our checklist. If we follow with the presentation, just to show you that the work done describes the analysis process of the potential impact on population health and also health equity on the 4th environmental framework as its main governance tools, because it is true also that when we talk about one health or health in all the politics, governance is one of the main tools that we have to make it work. Otherwise, everything could be just good ideas, good strategies, but then if you don't have a proper governance, when it is true that the Department of Health is trying to have the leadership of all those initiatives, there is no way of making it work. That's at least what we have learned. Finally, I just would like on our last image to show you that we have challenges. We are quite proud of what we have been doing all these years. As I told you, it's increasing the interest on other institutions, other policy makers about what all their projects or their new advances may have of impact in the health of the community, but even though that we have some of the challenges that we still have ahead. I think that working together as we are trying to do in this webinar may help us much more to advance in all the challenges we have. Thank you very much for taking care of the Basque Country and for letting us share what are our already done things, but also our challenges.
Many thanks, Minister, for your excellent presentation, and I'm happy that we managed to sort out the details because it's really very inspiring what you are doing in the Basque country. So thanks, and also in the chat, the link is there for the screening tool in English for those of you that are interested. Okay, so we have about 8 minutes left, not a lot, unfortunately, time flies for your comments and questions. There is already one in the chat from Nicolien Tamsma from RVM about mental health in health impact assessment, so it would be nice to hear about that, but please show your hand, virtual hand, if you want to make another comment or question in real life. So before I give you the floor, Liz, or would you want? No, I gave you the floor already to maybe respond to the question on mental health, and then I'll go through the list of other hands. Liz,
thank you, Carolina. It saved me from actually typing out a long response to Nicolien. So in Wales, as part of any health impact assessment, as part of our checklist that we use as a guiding framework for the assessment, there is a specific section on mental health and well-being. So every HIA in Wales will consider the positive or negative or unintended negative impacts or opportunities for mental health and well-being of the policy project or plan. And we also have been pioneers in mental well-being impact assessment. So using that as a specific tool to help drive mental health in all policies. So I've got plenty I can share with you if you want to get in touch. Thank you.
That's great. Thanks a lot, Liz. Markaya Henderson, please.
Yes. Hello. Can you hear me?
Yes.
Perfect. Thanks, Sophia and the panelists for a really informative discussion. I was just curious about thinking about HIA and all policies. What would you say to people that would question the practicality of that at the policy level, either for time spent, additional resources, or like policy responding to urgent crisis or quick developments? Thanks.
Thanks a lot, Makaya. I will go through some of the comments first, and then I see who would want to respond to that question. So, Luciana Costa.
Hello, good morning to everybody. Can you hear me?
Yes.
Yes. Okay, great. First of all, I want to really thank EuroHealthNet for this event. Since June last year, I think we did a great job to have launched this guide, and I want to thank the faces that I can recognize here and that are really helpful in this road that we are building together. I just want to pick on the words of Ben, because about the engagement of public health teams to take a step forward. So I just want to give you the information that the National Institute of Health are really interested right now to build up HIA training program, really focused on public health professionals. I've been collecting some help from Piedad, Liz, and other colleagues from EuroHealthNet that can really give a support to this work. If there's anybody else that has some program like that I would like really to be interested to have this information to put up together. And just to say that we are really thankful to EuroHealthNet for this opportunity to have this network, and that we could. I'm not speaking so much because I know that's a lot of people interested to give their input also. I see even Emmanuel from Portugal, so I think we begin already to have some steps in trying to have a collaboration to see if HIA finally in Portugal could be on the way, despite this long time that we begin make efforts and still not well implemented. So thank you to everybody.
Thanks, Luciana. Gabriele Gruber.
Yes, hello. Just a quick comment that with the beginning of the year, the Joint Action to Prevent NCD started, where a whole work package is dealing with health in all policies. And within this work package, we're having a task on health, in brackets, in impact assessments. So as it was mentioned, like the environmental impact assessments, there are impact assessment tools to do where health could be considered even more closely. So this is the task for our next 4 years. And I think there's a huge potential for cooperation on this, as there are like legislative impact assessments or technical impact assessment in the member states where health could be included more, and health equity, of course, when we're talking in this sense. So, but I'm thinking I just end here and we seek the cooperation.
Excellent. Thanks, Gabriele, to flag this up, because I was already thinking, oh, we have 2 minutes left and there's so much more to say and to do. But indeed, this joint action, Prevent NCDs, will give a great platform to continue to work on health impact assessments with many of you. So thanks for indeed highlighting that. Then I would like to give the floor to Ben, and then also to the other panelists, if there is something that you would want to add and reflect on some of the comments made, also about what to say to people that may be critical of all of the time and resources required to do health impact assessment, which is the first question we had. But Ben, to you first, and then I'll end with Piedad and Liz and Helen. Ben?
Thank you. It's fascinating, very exciting to hear of all the work going on. My request is about branding almost. We've heard about how it can be difficult to get people doing HIA and to get it on the agenda. It doesn't help if we start talking about mental health impact assessment, health equity impact assessment, etc., etc. Health impact assessment should look at all of that. So just be wary of developing lots of seemingly new tools and new approaches when we're also trying to get the wider world to take this up. So I would say we're all doing health impact assessment, and some of them will have special focuses. But I ask you, I put that to the group and ask you to take that approach. Thank you very much.
Very good point, Ben. Thanks a lot for making those points. Is there any of the other panelists who would want to have a final word? Piedad?
Yes, thank you. Well, I think it's an excellent seminar, and I think I invite all of you to also to be in Lisbon in the European Public Health Conference, where we have a special several proposals of workshops to work on different aspects of HIA, and I think it will be a great opportunity that we can extend our discussions there. And also from EUPHA, we'll try to propose a working seminar and a skill building capacity seminar to work in a very specific issues like mental health, how to address mental health problems and quantify it and incorporate it, because there is always a request on methodologies to address this type of health determinants. So just to invite all of you to collaborate and to send us ideas to be promoted from the HIA EUPHA section. Thank you very much.
Very nice to mentioning that. Anyone else? Then for Alba, do you have one final comment or reflection?
Not, I think we're a little bit over time, but just, to thanks to all the speakers and also all the participants. There were so many interesting comments in the chat as well. So for sure, we'll be looking over those. And we're really looking forward to continuing the collaboration with all of you in the months and years to come. So thanks for your time this morning. It was a really super interesting discussion.
Yes. Okay. Thanks to all of you, and also thanks for all of the participants. We hope to see you at our next events. Okay. Bye-bye, everyone.
Thank you.
Bye-bye, everyone.
Thank you. Bye.
Bye. Bye-bye.
Bye. Thank you.